Hi guys, welcome back to Momstein. Today we are continuing from last week's episode on medical conditions due to the lockdown. This is part 2, so let's continue.
Welcome to Momstein.
The first problem I want to talk about is nosebleeds. The number of cases of nosebleeds is rising. One patient of mine was a 39-year-old lady with no history of any high blood pressure, suddenly having nosebleeds. Her day consisted of all the household chores, plus power yoga, plus walking. She was doing just too much activity. I told her, skip the power yoga and follow it with me the next week. And the next week, her nosebleeds had automatically stopped and did not come back. Now, some of the other reasons why you could be getting nosebleeds, aside from exhaustion and overexertion, are 1. Nasal dryness. It's summer season, people are using ACs more. AC can cause the air to get dried and that can cause nosebleeds. Second, not using the AC enough. There's a rumor that coronavirus can spread through ACs and you should not use it. The summer heat is really not going well with people and that can cause nosebleeds. So please use the AC in moderation, keep your windows open, try to maintain the humidity in your house. The third reason is anxiety overexertion, as I already mentioned. The fourth reason could be nasal dryness due to sinusitis in the summer season. Allergic sinusitis is on the rise. The first aid for nosebleed is bend your head slightly forwards, pinch your nose and breathe through your mouth. Hold it for 5 to 10 minutes or till the bleeding stops. Apply some ice, that will stop the bleeding. And get your PP checked first. And avoid the use of nasal sprays like Otrivin. That will increase the bleeding. The second problem I'm seeing is elbow pain. One of my patients recently presented with classical symptoms of something called as tennis elbow. Doing the backhand of tennis, this area where all the forearm muscles are getting inserted can get inflamed. This bony jutting point. And this patient's backhand is more like jhadu and pocha and excessive movement over the elbow joint. Now, how do we take care of that? It's simple. Pop a painkiller, stop the movement, give your arm some rest and apply some ice. But household chores are not a hobby that you can give it rest. I know you will have to continue doing that. Some of the ways to prevent it if you're already having elbow pain is, first, don't Google it and diagnose yourself with arthritis. Second, use your shoulder joint while doing the jhadu, okay, rather than the elbow. Third, try to minimize this motion, okay. It shouldn't go to the extremes like this at every stroke of jhadu. So try to keep it at a minimum and use your shoulder joint and your whole arm. If you have already developed it, you can do a simple physiotherapy activity to get rid of the pain. Hold your hand like this. Suppose this is the arm, this is the elbow which is affected. Keep it extended at the wrist joint and give it a slight push with the other hand and hold that for 30 seconds. The second part would be reverse the movement, flex it and give it a slight push gently and hold it for 30 seconds. You can repeat this exercise 3 times a day and that should help you. The third condition that I'm seeing is increase in the number of UTIs or urine infections. Summers are here, people are not drinking enough water. Please drink up a lot of water, especially if you're a woman and everyone is sitting at home, you're there with your partners. If you're having more frequent intercourse, be careful about it. Pass urine before and after intercourse, and I have made 2 detailed videos on urinary tract infection previously. I will link them in the description box below. Make sure you watch it. The fourth medical problem is leg swelling and infection of the leg, cellulitis. I had 2 patients with this problem. One of them had leg swelling and the other one had leg swelling followed by infection. Both of them did not have blood pressure. Both of them did not have diabetes. And both of them were not on any medication that could cause this side effect. So what was the reason? Sitting for long hours in your work from home and your work calls. When people were in office, they just wanted to get up and move around and go for their lunch break, their cigarette break and their walk break. But now if you move from your desk, your wife will probably hand over a household chore so they don't want to move. So guys, please get up every hour, walk around for a minute, do some stretching and go back to work. It just takes a minute. If you cannot move from your desk, At least move your foot to make sure the blood keeps flowing in your legs and does not pool. It's almost like you guys are on transcontinental flights every day. Move around, guys. The fifth problem that I'm seeing is having diarrhea without eating any outside food. Anxiety could be one of the reasons for this diarrhea. To put it simply, anxiety can cause the brain to think that the stress signals are coming from the stomach and there is something infectious in your stomach and it's time to speed things up to get rid of the infection. That's why the diarrhea. The diarrhea you have gotten before your exams during college is also an example of nervous diarrhea. The simple way to tackle it, you could have some probiotic, eat light foods, and try to reduce anxiety levels. I've also made a video on how to take care of your mental health during this lockdown. Please do check it out. I'll link it in the description box below. That's all for today from Mom's Time. I have 2 more videos lined up in this series. One is period problems due to the lockdown and the second is taking care of your posture while working from home. So stay tuned and also subscribe to my channel and share this video with all your loved ones. I'll see you next week. Bye bye.